Welcome to the Journal Club. Although this paper is not at all new, it is one of the best review articles about medically unexplained symptoms in the emergency department. It's been published in the Emergency Medical Journal in 2006 by Stephenson and Price. I think, as the first piece of our Journal Club presentations, it is a worthy title to serve as the grand opening. So, let's get started.
As you can tell from its title, the paper is focusing on medically unexplained physical symptoms, or MUPS, a common and challenging issue in emergency medicine. These are symptoms patients present with that lack identifiable organic causes. They're prevalent in primary care and outpatient settings, and while precise data is limited in EDs, we know these cases are significant. Despite this, MUPS receive little attention in emergency medicine education, making management difficult. Today, we'll explore key knowledge to improve our handling of these cases.
Understanding terminology is key. Somatization refers to multiple physical symptoms due to psychological distress experienced as real by patients. Functional somatic syndromes are specific symptom clusters that frequently present in the ED. Other important terms include hypochondriasis, which we call today health anxiety, preoccupation with disease despite reassurance, dissociative disorders with neurological symptoms, factitious disorder where symptoms are intentionally feigned, and malingering for material gain. It's vital to use terms like functional symptoms to avoid stigma and maintain rapport.
The causes of MUPS range broadly. Some symptoms may have unknown organic bases still being studied. However, many arise from psychological issues such as anxiety and depression, or a complex mix of physical, psychological, and social influences. The biopsychosocial model helps us appreciate this complexity. Additionally, cultural backgrounds and patients' health beliefs play crucial roles in symptom expression and their approach to illness.
Management hinges on recognizing MUPs early and applying flexible communication strategies. Patients fall into different groups depending on acceptance of psychological factors. The reattribution approach is an evidence-based method to engage patients, expand the discussion to psychosocial aspects, and link symptoms to psychological distress without alienation. It's crucial to avoid rejection or collusion, instead offering legitimizing, empowering explanations that reduce anxiety and reinforce coping. Chronic somatization is challenging in the ED due to transient care teams. These patients do best with regular care from known providers, focusing on symptom management rather than cure. To improve ED care, identify frequent attenders in records and have senior staff formulate management plans. Communication with primary care providers ensures coordinated care and helps reduce unnecessary investigations and admissions.
Factitious disorder involves intentional symptom fabrication without material benefit, often consuming disproportionate healthcare resources. Recognize typical patient profiles and presentations. Management requires professionalism despite frustrations. While some advocate supportive confrontation, gently informing patients their behavior is recognized and offering psychiatry, others recommend non-confrontational engagement to foster therapeutic relationships. Communication with primary care and other EDs is critical to manage recurring presentations safely.
In summary, MUPs represent a common and complex challenge in emergency care. Understanding their prevalence, terminology, and multifactorial causes helps us manage these patients more effectively. Embracing a biopsychosocial approach and applying patient-centered communication techniques can reduce unnecessary investigations and improve outcomes. Remember to provide explanations that validate patients, avoid creating anxiety, and reinforce healthy coping. Although this paper was published in 2006, its message still stands, and, at least in emergency medicine,
there is not a lot has changed with regards of recognizing and treating patients with functional symptoms. Thank you for your attention.